Hello, you are listening to the Natural Healing Show for UK Health Radio. I'm your host, Carrigan, medical intuitive healer, Amazon #1 best-selling author. You can find out more about me and my work at CatherineCarrigan.com and UnlimitedEnergyNow.com. While you're there, definitely sign up for my newsletter so you can learn even more about how you can heal yourself naturally. Now, our guest today is Dr. Jonathan Reisman. Dr. Jonathan Reisman is a physician, an adventurer, a naturalist, and the author of the wonderful book, The Unseen Body, A Doctor's Journey Through the Hidden Wonders of Human Anatomy. You can find out more about Dr. Reisman and his wonderful work at his website, jonathanreisman.com. Welcome, Dr. Reisman.
Thank you so much for having me.
So, Dr. Reisman, I really love your book. And here at the Natural Healing Show for UK Health Radio, of course, we talk about how to heal yourself naturally. And part of healing yourself naturally, in my mind, comes to understanding your body. And most of us don't really understand our body. But your book it's like an adventure travel guide to the body. Which is a very unique take. So, Dr. Reisman, you've had an unusual career in medicine. You've traveled the world practicing medicine, Massachusetts General Hospital, Antarctica. I've been to Antarctica, really cold. The Arctic, Nepal, Kolkata, and among the Oglala Sioux in South Dakota, speaking Spanish, Russian, and English. What have you learned about the practice of medicine by working in these far-flung locations?
Well, I think you learn different things depending on where you go. Every travel I've ever done in the context of being a doctor has offered some lesson, a lot of lessons, really. I would say there's a few categories of things you can learn. One is you can go to really remote places to practice medicine, like Antarctica or the Arctic, where I was both places I was a ship doctor, and there you're working in the middle of nowhere with minimal technology, some medical supplies and medications, of course, and communications, but no specialists or imaging technologies or all the usual technological accoutrements that I'm used to working with in a large urban hospital, for instance. So you can learn a lot about the body. In a way, it takes a doctor back to their sort of most basic training of physical exam and using intuition and talking to the patient, because that's kind of all you have in those settings. So there's that kind of lesson when you go off to the middle of nowhere and work as a doctor, where you have to remember how to operate without all the technology doing your job for you. And a whole nother category, happy to chat further on any of these, but a whole nother category of sort of enlightenment or horizon expanding that you can expect when you work as a doctor in another country is the unique climate, geography, epidemiology, culture of that place. When I worked in India as a medical student, for one thing, you see a whole new batch of diseases that you don't see. In the U.S., where I'm from, the Northeast, we don't have dengue and malaria and filariasis or elephantiasis of the legs, and intestinal parasites are rare, tuberculosis virtually non-existent, leprosy, you never see it, even some polio, not many cases anymore there, thankfully, maybe soon to be more here, but so you see a whole new bunch of diseases that you never saw, and that certainly teaches you a lot, because you learn about those diseases in medical school, but then perhaps for your entire career practicing medicine in the US, you don't see those diseases, you tend to forget about them. And so going to those countries can be a good reminder of that. One more category of what you can learn is how different cultures view the human body. And whenever you're a doctor, diagnosing and treating disease and explaining to patients what you think is going on, what they should do, you have to take in cultural factors into account. That's true in the US too, where you treat people from all over the world. Immigrants, visitors, etc. Everyone brings their own cultural understanding of the human body, cultural traditions of health and disease. And so So you get a lot of that as well. So it's eye-opening in so many different ways, which is why I love traveling as a doctor.
So one of the things that's truly unique about your book, because in natural healing, we talk about the psychology and the emotions associated with different organs. But your book, you make a direct analogy between traveling the world and traveling through the body. And how, in your mind, how is traveling through our body like traveling through the world?
So the things that I loved about travel once I started traveling after I finished university was learning about. I was very interested in the natural world at the time, still am, but I really liked seeing how different parts of the earth have different kinds of ecosystems, different kinds of environments. You see different sorts of species of trees, you see different weeds growing on the roadside, you see different plants in people's gardens and on farms, you see different wild animals and different species of mushroom, etc. So, and when you go to a new place, you sort of, one of the aspects of discovery there, one of the excitements that I always had and still have, is that you discover this whole new group of species that are each living their own life and have their peculiar daily habits and ways of survival, and then also how they sort of interact with each other to comprise that ecosystem. So in a way, once you cut open the body, when I cut open the body on that very first day of medical school in the anatomy lab, you're opening up this new world almost, where you've traveled to a new place and you're peering into this new ecosystem where each organ or each body part similarly has its own daily life, its functions, how it works, where it gets blood from, where it sends its waste, what it makes with the nutrition the bloodstream sends it. And then so you have to understand each by itself, how it functions, what it does for a daily living, and then also how they all interact with each other to comprise the ecosystem of the body. So in that way, when you walk through or when you dissect through a body, you're exploring this new terrain that you haven't seen before. I certainly had never seen it before and knew very little about what went on inside the human body. And there I was, cutting it open and exploring this whole new geography, this new terrain with its exotic features, and understanding how each works and how they're all interconnected. And then on another level, I had to, for instance, memorize all the branching blood vessels of the body, from the biggest, let's say the biggest aorta, all of its branches. I have to know their name, the names of those branches and the branches on the branches, until you get to pretty small arteries, down to your wrist, down to your ankles, let's say, those small arteries there, and the similarly sized arteries feeding your organs. And so when you learn that and memorize that, you're almost sort of walking through the cardiovascular system. When I get a test question about what's the name of the branch that comes off, the celiac axis right behind the stomach, and you're walking through these paths in your mind down the aorta, past the renal arteries, not yet to the iliac bifurcation, etc. And so there's an element of travel there where you're thinking through a landscape. And the same goes when I'm diagnosing patients. When a patient has chest pain and maybe having a heart attack, I'm thinking, based on the EKG, I can tell where the blood clot is in their coronary arteries. And in a similar way, I'm marching in my mind through this map of the coronary arteries that I've memorized and have walked down so many times in my head whenever I look at an EKG. It's like a familiar terrain of branching blood vessels or branching streams on the earth, and you're sort of traveling in your mind and able to locate specifically where it is based on that system that you know so familiarly. So there's a few different ways in which traveling in the body is like traveling through the world.
Now, in your wonderful book, The Unseen Body, A Doctor's Journey Through the Hidden Wonders of Human Anatomy, you say that human bodies are more than a collection of individual parts, and that the clues of the well-being of one organ are often lie hidden within the other. How can we begin to understand our body as an ecosystem?
Great question. Our bodies are very much like ecosystems. If you took a pile of organs and skin, obviously that would not be a person. But once you're animated and everything's working together properly, you become the individual that you are. So certainly we as individuals are more than the sum of our organs and body parts. as a doctor, the first time, the thing that sort of opened my eyes to this sort of ecological interconnection between the organs is that, in fact, oftentimes we diagnose disease in one organ by looking at another organ. That's very common. For instance, a lot of times problems with the pancreas first manifest as a liver issue. So, for instance, pancreatic cancer, sometimes the first sign is that someone's skin turns yellow. The reason is because that tumor is blocking up the flow of bile from the liver, and that bile is backing up into the bloodstream and making the bilirubin high, which turns you yellow. So, in a way, you're looking at problems of the liver and the biliary tree and the bile drainage to tell you about a neighboring organ, the pancreas. Similarly, I might find glucose or sugar in my patient's urine, and that's the first hint of diabetes, which is also a problem of the pancreas. So there's nothing inherently about urine that makes you think of the pancreas, but that's another way in which these two disparate things are connected. Or there's a million other examples. Ovarian cancer often first manifests as a bowel problem, a blockage of the bowel, a bloating, etc. And so that's, in an unrelated organ. Or heart failure manifests as difficulty breathing, right, which is a lung problem. And it's because the heart, when it fails and the pump weakens, fluid backs up into the lungs. And so we're constantly diagnosing things in one organ to figure out how the other organs work. And in my book, I call the kidneys, for instance, a keystone species in that ecosystem, because a lot of times the kidneys beginning to fail are a sign that there's severe sickness in some other organ. You can have an overwhelming pneumonia in your lungs, and if I start to see your kidneys fail, it tells me that's a very severe pneumonia. The same with a liver failure issue. Once the kidneys start to fail, it's telling me about the liver, that things are getting serious. When the heart fails, if the kidneys also fail, it's telling me how severe the heart failure is. So the kidneys are kind of unique, as I point out in the book, but really all organs share that ability to tell you about what's going on in other parts of the body's ecosystem. And a simple matter of everyday practice of medicine and getting the diagnosis right and helping patients means understanding that body in that ecological way.
That's fascinating. The gentleman who created the system called Touch for Health, John T., part of my understanding of how he created that was as his wife lay dying, he observed the different organs shutting down and how each organ shutting down affected other parts of the body, like your muscles and so on. Now, in natural healing, we have a different view of life and a different view of health than traditional medicine. In Chinese medicine, stoppage of the flow of qi is seen as the cause of most illness. So we talk about, in Chinese medicine, they talk about different qi imbalances, and there's an over energy in one organ and an under energy in another organ. In Western medicine, health depends on the constant flow of bodily fluids. Can you explain for our audience how these concepts are similar and also different?
Sure. I'm not very knowledgeable about traditional Chinese medicine, but I do know the basics of the flow of qi and sort of the blockage of it being seen as a big problem. And I sort of knew that coming into medicine, or I had heard a little bit about it. And when I got into medical school and started learning about all the diseases that afflict the human body, I found that it was actually quite similar to the cause of a lot of diseases. Our bodies are full of different bodily fluids that we learn about in medical school, from, blood, urine, feces, tears, bile, pancreatic enzymes, saliva, our tears and lacrimation. Many other fluids flow within the body or outward from the body into the outside world. And a huge proportion of the diseases that afflict people, or the things that cause us pain and suffering and death, is a blockage of flow in any one of those fluids. So everything from a kidney stone that blocks up the flow of urine, to a gallstone that blocks up the flow of bile. There's even salivary stones that block up the flow of saliva. There's stones in our inner ears, our balance centers, that stop up the flow of that fluid that flows to help us figure out how we're oriented in space. Are we upside down? Are we right side up? Are we rotating? Are we moving? there's stones there that can actually stop up the flow and cause, very commonly cause a lot of vertigo in people. It's called benign paroxysmal positional vertigo, BPPV. So just another example, there's so many diseases that involve the stoppage of flow. Appendicitis mainly is a problem of flow because a little piece of whatever, something you ate, or a little concretion of stool gets stuck in the mouth of the appendix, blocks up all flow. It causes swelling, inflammation, more blockage. And it's that blockage of flow into and out of the appendix that causes the problem. Same thing with diverticulitis. Same thing with cholecystitis in your gallbladder. Pancreatitis is caused by blockage of the pancreas flow. Constipation even is a blockage in the regular flow of stool. One of the things that afflicts humans, very commonly. Heart attacks, strokes, pulmonary embolism, it's all a blockage. Those are blood clots that stop the flow of blood. So when, before like 1850, doctors knew very little about what actually causes disease. And in the last 200 years, we've learned an enormous amount. And it turns out a lot of it is just the simple stoppage of flow, which means that a doctor's job is often very similar to a plumber's. You just have to reestablish the flow basically by getting rid of the blockage.
And that's very similar to the work of those of us who do energy healing, because as an energy healer, I'm going to assess the flow of energy in the body. I'm going to notice where the energy is not flowing or where the energy is blocked or congested, and use chi, literally prana energy healing, in order to unstop it so that everything flows. It's a basic principle of healing. So with that fascinating information, let's take a break and listen to a message from one of our commercial sponsors. And we'll be right back with Dr. Jonathan Reisman, author of The Unseen Body. Dr. Jonathan Reisman, when I was reading your book, you talked about the throat, and you said that when you first started studying your throat, you thought, this doesn't make any sense. Why is our throat the way that it is? It seems to be a problem. How is our throat poorly designed on one hand, and yet at the same time a blessing at the time of many people's deaths?
So when I first learned about the throat, it did seem rather like a silly design. There's so much about the body that's brilliantly designed and so efficient, and so amazing, and sort of seemingly the creation of a genius, that when you get to the throat, it makes you wonder. The throat is a really important intersection. Everything we swallow goes through the throat, and everything we inhale goes through the throat. And that's sort of the problem, because once they pass through the throat, they have to necessarily, if we are to stay alive, separate into their separate tubes. So all food and drink and saliva and snot and mucus and whatever else we're drinking must go down the esophagus. And air alone must go down the trachea to the lungs. And those two tubes are right beside each other, a few millimeters between them. And if anything that's supposed to go down the esophagus ends up in the trachea, you could be in deep trouble. I mean, one slip up and you can die. So it seemed rather inefficient, to say the least. And then when I started working in the hospital and caring for especially elderly patients, but really a variety of ages, people often suffer from issues with the throat when they start to get weak from a variety of neurological diseases, from perhaps repeated strokes that are impairing their swallows coordination, from a variety of other neurodegenerative conditions. They suffer from the problem of aspiration, which is similar to choking, except instead of a large, let's say, piece of food that suffocates you, quickly, it's sort of these very small amounts of food, drink, saliva, including the bacteria that lives in your mouth and throat. These sort of go into every time this person swallows, perhaps a little bit ends up in their lungs. And that can cause problems with breathing, but can also cause pneumonia, because those bacteria that you're swallowing down get in there. They're not supposed to get down into your lungs. Your lungs are supposed to be relatively sterile. and your ability to swallow helps keep bacteria out of your lungs. But when you aspirate, your bacteria do get down there. And to top off this seemingly silly and terrible design, the number one cause of pneumonia, the number one bacteria that causes pneumonia, actually lives in the back of our throats, right there, right above our lungs, right above the entrance to the trachea. It's almost set up so that if you aspirate, you end up bringing bacteria down into the lungs, the kind of bacteria that loves growing in lungs and causing pneumonia. So it seems like a very silly setup, especially in patients who are weak or debilitated. It They are at particular risk of aspiration, which can then make them even sicker. So it seemed like a very silly design in contrast to most other designs of the human body. But what I did, I mean, one side effect or one side benefit I discovered, which, like I said, I have a lot of old people who have been suffering from aspiration pneumonia, people with advanced Alzheimer's or other forms of dementia, or just other kinds of irreversible decline from some disease. A lot of them do start aspirating as they get weaker and weaker. In a way, aspiration is one of the last ways the body gives out. We use our strength to get through our daily lives, to feed ourselves, to dress ourselves, to clean ourselves, to wipe our bottoms. And once you're too weak and debilitated to do any of that, it's almost sort of like the last and final weakness is your throat's inability to keep food, drink, saliva, and those bacteria out of your airway. And a lot of people with advanced dementia, for instance, do die of aspiration pneumonia. And in the book, I talk about one patient like that who was very advanced and couldn't speak, couldn't interact, couldn't recognize any of her loved ones or relatives, who kept bouncing back to the hospital with repeated episodes of aspiration pneumonia. And she ended up dying, and with her family there. And it was one of the least fraught deaths I've ever been at, because everyone in the family was ready for it. They knew it was time. There's often a lot of family fighting goes on around death. There was none in this case. And it made me reflect on how once this poor old woman, when her quality of life had basically disappeared, her throat began to malfunction in swallowing and caused her aspiration pneumonia. And it seemed to me almost like the body's way out of a life that seems kind of dominated by suffering instead of enjoyment. So people who are just debilitated by repeated strokes start to aspirate and get aspiration pneumonia. People with advanced dementia start to aspirate and get aspiration pneumonia. So for these people with these conditions where they're just failing and declining, it almost seemed like a secret hidden cyanide pill in a locket that you keep in case of emergency. And so it's sort of this exit for the body when life is sometimes no longer worth living. Of course, it's never a doctor's job to decide when someone's life is not worth living. I may have my own opinions, but I, take the lead of the patient or their families to decide what goals they want to achieve or try to achieve, and what their quality of life is. But I have my own opinions, and that, reflecting on some of my patients who have been very ill and towards the end of life, I did realize that sort of another perspective on the throat, which seemed rather silly at first.
Dr. Reisman, you say that our kidneys are like a canary in a coal mine, signaling potential problems for the whole body. Can you explain for our audience what you mean by that?
Sure. As I was saying before, where there's some different organs can tell you about the health of other organs, the kidneys are particularly suited to sound the alarm. In that way, they're like a canary in a coal mine. They're sort of the first alarm that goes off, and often give doctors a hint that some disease is progressing or severe. If somebody comes in, let's say, with a fever and an infection, oftentimes if I'm checking blood work or evaluating their organs in some way, with blood or urine or imaging or something, oftentimes it's kidney failure that gives you the only hint that things are sort of precarious, or that the disease is more severe perhaps than you thought. If I talk to someone, let's say, and they seem healthy, normal, yes, they have this illness, but they're doing fine, but then I check labs and see, let's say, their kidneys are struggling, that's a very subtle and important sign that things are more serious, or that maybe they do need some IV fluids or some medicine or some admission for observation or for other more aggressive interventions. So, and the kidneys they're often the first to go in a way, which makes them seem a little wimpy. In fact, kidney failure is so common. Some people just get a little dehydrated and their kidneys start to fail. In hospitalized patients, kidney failure is probably the most common kind of organ failure. Almost seems, ready to fail at any moment. Such a wimpy organ, but another perspective I got on it was how the kidney is actually that canary in the coal mine and the first to recognize when something is going wrong, and therefore it's a way of showing you as the doctor that things are in fact progressing.
In your wonderful book, you explain that heart specialists divide themselves into two groups, plumbers and electricians. I love this analogy. Can you explain for our audience the difference and how that correlates to different kinds of heart problems?
Sure. So as I mentioned, a lot of medicine is plumbing because a lot of disease is blockage in the flow of some fluid, just like a clogged toilet. So, for, for instance, a heart attack may be the most, at least one of the most common and most deadly forms of a blockage or a clogged toilet in the body, where a blood clot forms in the coronary arteries and is stopping blood flow and oxygen delivery to part of the heart. As I mentioned, a lot of what doctors do is basic plumbing, and so the kind of cardiologist that will help unstop that blockage is an interventional cardiologist, basically, and they do what's called cardiac catheterization. So they introduce a catheter often to the large arteries in your groin, your upper leg, or even in your wrist, and thread something all the way down up your arm or up your leg, all the way to your aorta, and then down just near the opening to your heart, almost like a plumber snaking a drain. And what they'll do there, a variety of techniques. Sometimes they can actually suck the clot out with a suction. Sometimes they also can put a stent where they blow up the artery like with a balloon and then put a metal cage in there to prevent it from closing again. Sort of like, you know, fixing a part of your pipe, let's say, that's collapsed in on itself. So they're the plumbers of the cardiology world. So that's a huge part of heart care is fixing those blockages. Now, the completely other kind of heart problem has to do with electricity. So, arrhythmias or abnormal heart rhythms are a huge issue in cardiology. And so, what we call electrophysiologists are the cardiologists that will deal with those issues when the heart goes too fast, goes too slow, goes irregularly with its beat. Those are all problems for the electrophysiologists. So they're the electricians of the cardiology world. So once you're a cardiologist, you can actually go, I mean, you can stay a general cardiologist and sort of see a bit of everything, or you can specialize in the plumbing or specialize as the electrician.
Using your plumbing analogy, which is a great way to understand. And again, part of what I love about your book is it helps people have a better understanding of their own body. How do general practitioners or internists focus on clogs while trauma surgeons deal mostly with leaks?
Right. So there is that other kind of plumbing problem. There's blockages and then there's leaks. We talked about how there's a lot of blockages going on in medicine. Now, some of those blockages need a procedure to unblock them. Like I mentioned, a heart attack does need a cardiac catheterization to unstop it, remove the blockage, or sometimes even a bypass surgery where you're just not removing the blockage, but just bypassing it with another artery to just go around it, give blood a path around it. But generalists, internists in general, also treat a lot of other blockages without procedures, but rather just with medication. So blood clots, for instance, which are a huge part of disease, can cause strokes and heart attacks and pulmonary embolism and DVT. Blood clots are a big part of the diseases that affect people. And so one of the big things that internists do for them is treating with blood thinners. The first blood thinners came from leech saliva in the early 20th century. And since then, we've gotten a number of new ones, including sort of, chemically manipulated things from nature like that leech saliva. We have many derivatives that we've made from it that work better with fewer side effects. We have heparin and warfarin and Coumadin. And even in the last few years since I finished my training, there's a bunch of new anticoagulants on the market, like Xarelto and Eliquis, and they just seem to be proliferating. And a big part of what internists do is dealing with those blockages, treating with blood thinners, manipulating the blood to prevent more clots and to dissolve the clots that are already there. So a lot of what we do is dealing with blockages. Trauma surgeons, on the other hand, deal with the other plumbing problem, which is leaks. In other words, bleeding to death. So we our blood is obviously blood is crucial. One of the downsides of having a liquid medium needed to deliver oxygen and other nutrients to all our cells is that if you spring a leak, you could die. Thankfully, our blood is very intricately managed in terms of clotting and not and unclotting. The we our blood has to clot, otherwise every paper cut would kill us, or every nosebleed would be deadly. So blood has an amazing ability to clot, but then of course there's the side effect of these clot-related diseases. So because blood clots, we don't bleed out from a cut, but because it clots, we get things like pulmonary embolism, heart attack, stroke, etc. So finding just that right balance where blood neither clots nor spills out of the body is always the goal, I'd say.
So with that, let's take a break and listen to a message from one of our commercial sponsors here at UK Health Radio. And we'll be right back with Dr. Jonathan Reisman, physician, adventurer, naturalist, and author of The Unseen Body. Hang in there and we'll be right back with more from Dr. Reisman. In your book, you tell the story of Natalie, a morbidly obese woman who was unable to be saved due to her extreme body weight. And of course, in our culture, there's a lot of fat shaming. There's a lot of opinions that everybody has about fat. Like, I want to be thinner, and people mismanaging their food. And there's a lot of misunderstanding about the role of fat in the body. How does fat in our bodies act like an endocrine organ and secrete hormones promoting clot formation?
So indeed, fat, I think our understanding of fat is very basic and really at the beginning. On its most basic level, fat, of course, is a place to store energy. And when, in ancient times or even in modern times for many people where the supply of food is irregular, obviously fat is a way of storing energy so that you don't need to eat every day or all the time and can still survive. And it's a very good mechanism. And on top of that, I think a lot of our fat stores are just beneath the skin, subcutaneous fat, as it's called. And that's convenient because you get to store that energy and then you get a little bit of insulation out of it. So it makes perfect sense. Why not store it under your skins just so that, you get a little warmth and insulation from it while it's storing that energy for you. I think that fat is really almost many different kinds of organs. I spoke to a fat researcher at Temple University who was telling me how when you look at fat, even in the layer of fat beneath your skin, towards the top of that layer, closer to the skin acts in certain ways and appears certain ways under the microscope. And as you go deeper down, even within that single layer of subcutaneous fat, fat looks different and acts different. The cells are shaped differently. So, and then not to mention, there's also fat in our abdomens around our organs that are even more different from any of the subcutaneous layers of fat. So, and there are other kinds of fat too. And so different parts of the body have different kinds of fat doing different things. One of the sort of more complex understandings or deeper understandings of fat is that it does in fact act like an endocrine organ. We don't think of fat as an endocrine organ, of course, an endocrine organ being one that secretes hormones into the bloodstream that then those hormones act on some other tissue at some distant part of the body away from that secreting organ. So fat does appear to maybe play a role in estrogen metabolism. In fact, there are some enzymes in fat that, for instance, can convert testosterone to estrogen, and estrogen does play a role in blood clotting as well. I don't know what the latest state of that science is. I'm sure we have a ton more to learn, but that very basic understanding may play a role in why people who are obese sometimes are at increased risk of certain kinds of blood clots, like DVT or deep vein thrombosis and pulmonary embolism or PE. So, fat is a very complicated organ, and we know very little about uh, when and why and in whom it accumulates on our bodies, and what kind of fat and how much should be in our diets, and how either of those things relate to the fat in our bloodstream in the form of cholesterol and triglycerides. So to me, it feels like the story of fat is really in its very beginning stages, and hopefully we'll learn a lot more over the coming decades.
You tell many stories in your book of dissection as a medical student and what you learned by dissecting bodies. What do the lungs of a healthy person look like? And how does smoking cigarettes and marijuana change our lungs?
So the healthy lungs of a person are, a pinkish beige and very smooth surface and very pretty. I think if you've seen lungs before, they look very clean and sort of healthy, pinkish, like most tissue that's healthy. They're very pink. In my cadaver, once we cut open his thorax, which we used a tiny circular saw on each side of the chest and lifted off the breastplate, basically, and exposed the heart and the lungs, and we immediately could tell that his lungs were gray colored, basically the color of cigarette ash. And that was an obvious sign that he had been a smoker. And that, when you're inhaling all the smoke and soot from cigarettes, it's really the burning vegetable matter that causes so many problems. I mean, the nicotine is a separate story, but just burning vegetable matter when you're inhaling it is not great for your lungs. And so if you do that for decades at a time, your lungs can definitely change to take on that very unhealthy look. And it also changes the structure of the lungs. An emphysema, the chronic inflammation of cigarette smoke, can cause weakening of the elastic nature of the lungs. And so the lungs don't recoil as well when, every time you exhale, your lungs shrink down by recoiling as they empty of air. And so that recoil is not as robust in people with emphysema. So their lungs tend to get bigger, their chests tend to get bigger. The mechanics of breathing don't really work as well. And cigarette smoke actually affects a lot of organs. It's a huge risk factor for coronary artery disease, and my cadaver probably did have that. You could feel even on the coronary arteries snaking across the surface of his heart. When you squeeze them with our gloves when we were examining him, it actually felt sort of like caramel, like they would crunch beneath our hands, between our fingers, which was a sign that they were sort of calcified and hardened, and probably he did have coronary artery disease, which uh, is another result of cigarette smoke. And many other organs are affected as well. Almost the whole body. It's just sort of the lungs that take the brunt of the smoke itself and can change to that unhealthy color.
So many people think that smoking marijuana is okay, and they're under the misapprehension that it may even be healthy for you. How does smoking marijuana change the lungs and affect the body, the rest of the body?
I would say I don't know a ton about that. I think that if you smoked as many joints of marijuana as you smoke cigarettes, like let's say a pack of 20 a day, it probably would affect your lungs. But I think almost nobody smokes that much. So I'm not sure how much, let's say, a few inhales of marijuana a day would affect your lungs. Probably not to the extent of smoking a pack of cigarettes a day. So I think, I mean, every drug we put in our bodies affects different people differently. Some people, when they start smoking marijuana, it can ruin their life, and other people are very productive, stable, functional citizens when they smoke it. So I think it's a little different for everybody.
I think it was Willie Nelson said that his health program was smoking marijuana and exercising. Now
There you go. He seems healthy at his age.
he's pretty productive. Now, here at the Natural Healing Show for UK Health Radio, we speak with many experts who practice holistic wellness, the process of seeing a person as a whole and of treating the body as a whole. How have your many years traveling all over the world, working as a physician, affected the way you see and treat a patient as a whole being?
I think a big part of it is, people, to some extent, we are collections of organs. So naturally, yes, you must know about all of those organs, but you also must know how all those organs relate to each other, how one affects the other, how any medicine you're going to prescribe for one of them might have side effects that impact negatively that other organ that seems unrelated to the disease at hand. Beyond that, I think, there's layers of people. There's layers that comprise people. There's organs. There's how the organs work together. But beyond that, there's our emotional lives, our psychological lives, our cultural traditions, our relations in the world. I think our hopes and dreams, our fears. I think all of those are important for a doctor to take into account. And it's not always a simple. I think, here's the diagnosis, there's the treatment is sort of the most simple level of algorithmic thinking for a doctor. And I think that you get a lot more benefit for your patients if you do think about some of those deeper levels. Not to mention, because a lot of diagnoses that we give are really in a gray zone. Like, does the person actually have pneumonia or not? Sometimes it's obvious they do, and sometimes it's obvious they don't. But there's a whole lot of diagnoses of pneumonia that we give when it's not clear. It's a gray zone. And I'll often try to talk to the patient and involve them in the decision to give them antibiotics or not, let's say. I'll sometimes ask, are you the kind of person, let me tell you a few different ways, and all of them are reasonable. We could wait and see, and you could start antibiotics if it gets worse, or we could start them now if you're that, if that's sort of more your approach. And I tell them what I would do, probably wait, and then we make the decision together. So sometimes, like, that's a small example where a person's values or how aggressive they are, their particular approach to life and to their own disease. I try not to take my approach and apply it to other people. I like other people to be in charge of their healthcare and their decisions, and I'm there more merely as a consultant. I see myself literally as a plumber who tries to tell you what I think the problem is and what your options are to fix it. But I try not to say what you should do. Should is for people to decide. A doctor only, it's my job to present the risks and benefits of every option, but it's for the person to decide what they should and shouldn't do. So I think understanding people on those levels as humans in a context of, socioeconomics and culture and history and tradition, I think seeing the person as a whole person like that is crucial to get them the best healthcare.
Now, here we are at the Natural Healing Show for UK Health Radio, and you practiced medicine literally all over the world and dealt with all different cultures. How do you personally incorporate natural healing in your own life?
Well, I certainly think a huge part of staying healthy and healing is sort of um, the natural things of diet and exercise and getting outside and doing what you like to do and enjoying life. I think are a huge part of staying healthy. And if you're not doing those things, why be healthy at all? I certainly think a lot of what medical doctors do probably is not necessary or helpful, and it's sort of hard to find. So it can be hard to find where that line is. Who is going to be helped by a treatment? Who is not? Certainly minimizing medications is always a good idea. In general, I mentioned my approach would be, for instance, in the patient with a borderline pneumonia, to watch and wait. I think a lot of just time, a lot of the times, time is just a crucial factor in healing. And a lot of what doctors do as a treatment is kind of just to give the patient something to do while time alone heals their condition. So I think, you know, generally the natural approach is often the right one, especially when it comes to diet and food and lifestyle. When want to know what's healthy for the human body, I sort of think, what did people do 10,000 years ago? And that's probably the answer of what's healthy and what's not. There's certain cases where modern medicine is obviously absolutely essential. There's a lot of cases where it's not needed, and there's a lot of cases where it's a gray zone. Will it help? I'm not sure. Maybe some people, but how do you know if there's one person in front of you is going to be one of them that's helped and not hurt or just not affected? That's harder to know in those gray zone cases. I feel like a lot of advancement in medicine is figuring out where those gray zones are, teasing them out to know who we should do more on and who we should do less. But I do think a lot of the advancements in the coming years will be about doing less for people, not more.
And final question, Dr. Reisman, observing the practice of medicine all over the world, what do you think makes a good doctor and an effective healer?
Great question. I think there's two sides to medicine. There's a very cold, algorithmic, calculating, scientific, analytical part where you have to know a lot about the organs, you have to know a lot about health and disease and how organs work and how they malfunction in disease. And you have to know, what the sound you're listening to in the patient's heart or in their lungs and what that tells you about the state of health or disease. So there's a very calculating thing. I think in a way, AI probably will be able to do that better very soon than a human doctor does. That cold, analytical, data-driven process of decision making. You can look at their lab values. Oh, the sodium is low, the pH is high, the chloride, magnesium, calcium are often this way or that way, and X plus Y equals Z. Therefore, the diagnosis is this. But there's a whole other side of medicine that's really all about human to human interaction. You're in that room with a patient. It's this little quantum of a very strange society where the two people just met but are discussing all these intimate details of the patient's life. What happens in their bathroom, what happens in their bedroom, what perhaps things they don't even want to talk to their spouse about, they're telling you about, even though you just met. And so there's a very human side where you are interacting human to human, not just doctor to patient in this, analytical way. You worry about things like how much eye contact you're making. Too much or too little can be awkward. So you want to do it just enough. Touching the patient, you can do it too much or too little. If they're upset, comforting them with a touch. There's a fine line of touching too much, touching too little, too much eye contact. You're just trying to find that right balance where you're two humans interacting with each other on a human level, and you're showing your compassion, your empathy for this person, understanding what their life is like, what they're going through, how this disease is impacting their life, and that all must go into your decision making of how aggressive to be, what kind of therapies to try, further testing or not. A lot of it's not written anywhere in stone. If this, then that. It's sort of judgment calls, a million a day. You make so many judgment calls every day, like me working in the ER. And sometimes you get decision fatigue, actually, it's called, because you make so many decisions on behalf of these patients. But I really think taking in the whole picture of the person as their body, but also as this individual with a life, you have to take all of that into account when being a doctor. And so you sort of have to encompass both of those sides. You have to have good analytical observation and decision making, and you also just have to be a person, like a normal human who understands other people and can relate to them and not be too awkward.
Wonderful words of wisdom. You've been listening to the Natural Healing Show for UK Health Radio. I'm your host, Catherine Carrigan, medical intuitive healer, Amazon #1 bestselling author. You can find out more about me and my work at catherinecarrigan.com and unlimitedenergynow.com. While you're there, definitely sign up for my newsletter so you can learn even more about how you can heal yourself naturally. Our guest today has been Dr. Jonathan Reisman, physician, adventurer, naturalist, and author of The Unseen Body, A Doctor's Journey Through the Hidden Wonders of Human Anatomy. You can find out more about Dr. Reisman and his wonderful work at his website, jonathanreisman.com. And remember, when you develop a deeper understanding and a reverence for the miracle of your body, natural healing occurs. Thanks so much for listening, and we'll see you next time.